complex and we were discussing whether I was here before, I checked my emails and I see an email in 2008 from Mr. Thomas John inviting my organization that I represent, the Alzheimer's and Related Disorder Society of India, the Calcutta chapter, to come and present, share the work that we do. So it's great to be back again here, and thank you to all at Antaragram Institute of Health Sciences, and especially my namesake Nilanjana Basu for giving me this opportunity to come and be a part of this lecture series. A couple of things. I am not very comfortable standing in one place and talking, but I guess I will have to because there's something going on there. And so, I don't know how well I will be able to speak because the moment you freeze me, sorry? Oh, no, that's okay. Thank you. And the second one is that when Nilanjana came and told me, she shared the topics that she was looking for a speaker. One was AI, the artificial intelligence in dementia care, which is a very new field. And the other was the couple of other two. One was financial challenge and the other was legal matters. And I said, well, I understand them, but caregiving and training is my expertise, and I'm not sure if I'll be able to do good justice to this. But on her insistence, I'm here today. So we will be talking about discussing, exploring the financial challenges. Now, it is not going to be only about numbers and policies today, because financial challenges, navigating that as a family member for someone living with dementia, we are talking about real people, real lives, real problems, and real future. So I think we will together explore how well we can really support family members living with the day-to-day challenges, not just finances, but various aspects. But today, because the topic is finances, we will definitely focus on finances. But before I start on the finances part, nothing is complete without understanding what is the overall impact of dementia as a condition. And nothing can best explain than this slide. So you have a lady who is experiencing dementia symptoms, and the husband is sitting beside her. They are spending time together. And the husband says, in the moonlight, your teeth looks just like pearls. And the wife, who is experiencing dementia, answers him back saying, who's Pearl? And what were you doing in the moonlight with her? So the fact that Pearl is something that my husband is trying to compliment me with, along with my teeth, is not comprehensible to the person. So a family member is facing this challenge day in and day out. And this is just one aspect of it. And there are millions of others. If you really look at the list of the caregiver role of a family member, you see, of course, dealing with the impact of the disease, which is huge, the physical, the emotional, the social, anything, everything is a challenge for the family member. They also have to handle the stress and the emotional toll that they are facing day in and day out themselves. There's no one really beside them theoretically. There are people who are telling them, yes, we understand how difficult it is, but to be beside that person and really help that person, there are very few. So whatever stress and emotional toll the family caregiver is just dealing on their own. Having patience with loved one. We as experts are always telling the family members that be patient with your patient or with your loved one. It is easier said than done. How do you practice patience? You're not born with it. You basically practice patience in your daily experiences that you come across in life. And so telling a family member that you have to be patient is very easy. If you can really show them how to be patient, that would be much more effective. Assisting with daily activities of living. So, eating, feeding, dressing, grooming, toileting, name it. Everything has to be assisted for people living with dementia at a certain time of their lives. Not in their early stage, but as the disease progresses, they need help with their activities of daily living as well as their other activities of daily living, which could be day-to-day tasks. Keeping loved ones positive and motivated. We also tell family members sometimes that irrespective of the disease condition, you have to you have to ensure that the person who is living with the experience should be motivated to participate in life. And that's one of the toughest things to do. Because here you are with a disease that is very, very unforgiving. That person is losing their self sometimes, losing the environment that is telling them what to do, what not to do. And hence, keeping that person motivated and positive is very difficult. And therefore, a lot of times we encourage family members to ensure that they start that journey right from the beginning rather than waiting when things are going out of hand. Managing and administering medications is a huge job. All this time their loved ones was taking medication but doing it on their own. There are family members who will tell us that I wasn't even aware what medication and what time he was taking. Now I have to really keep tag of what he has to be given as well as my medications that I need to take. So managing and giving medication is a huge task, and with technology now we have made it much easier for family members to deal with it. But there are a lot of changes happening in medications. And this person living with dementia is just not living with dementia. He has other chronic conditions also as they're aging. So they're taking multiple medications. And so this is a huge task. Managing other household duties, taking care of the household, going to the bank, making sure the groceries at home, maybe taking care of another elderly member at home. So there are many duties that the family member is juggling all the time. Today we will focus on the planning and managing of finance, which is a huge issue now, not just in India, but all over the world. And we really need to understand how and in what capacity and to what extent we can actually help family members. Some are practical, some are going to be theoretical, but we will have to really take case by case and see what is working given their background. I'm going to start with a couple of case studies, and they are real case studies. These are real people, real problem. This is Madam Meera that you see. She is a retired school teacher in her late 70s. A few years ago, she began misplacing things. We all do, right? I mean, all of us are misplacing things. So it started with misplacing things like keys, grocery lists, even her pension documents. Her daughter, Anjali, brushed it off at first, which we usually do. I mean, this is old age, she has retired, So therefore, it's very normal to go through these experiences. But then came the bank calls, missed EMIs, a bounced check, strange withdrawals. And when Anjali, the daughter, stepped in to check what was going on, she found that there were a lot of unopened bills in the house, investments that were forgotten, and a life insurance policy that lapsed long back because she no longer remembered to renew it. So, as Mira's memory started fading more and more, and she had problems with other cognitive issues, it became a puzzle for her to solve the financial aspect of her life. And the family members started to focus more and more on her medical aspect, on her dementia, on her forgetfulness, on her inability to take care of herself. So the whole family was focusing on the medical and the daily challenges. And therefore, these financial aspects were not really looked into carefully. And therefore, no planning happened at that stage. And Meera, along with her family members, are not alone in this journey. There are thousands of families that I have come across over the past 30 years of my work, and there are others who are in this work who have come across in their life. There are millions of families across India and globally, like Anjali and the rest of the family members, who are trying to navigate not just the emotional toll that dementia takes on the person, but also the financial means that they never expected. This is another story. This is Mr. Subramaniam. He's a retired banker. He was a crossword champion and a very, very proud grandfather of three. At 78, he still insists on managing his own money. And if you tell him that you did not worry about it, he gets really, really angry. Because his answer is, I balance the books during the emergency. And so don't tell me how to pay my electricity bill or how to take care of my finances. So you are dealing with a person who is in their probably mid early stage, understanding that he is goofing up, but not accepting it. So one day, his daughter noticed 5 mixer grinders that was delivered to the house. And this is a very real story, just a few weeks back. They were on a great offer, he said. And so I purchased 5 of them. That was his logic when he was asked, why did you get 5 grinders? Why do we need 5 grinders at home? His answer was, he was getting a good deal, so he got 5 of them. The next week, he donated 10,000 rupees to what turned out to be a WhatsApp forward for a fake temple fund. And when the daughter gently asked about the missing bank passbook, he said, it must have gone to the bank for a walk. He was a very humorous person. He is a humorous person. So his answers are always like this, the passbook must have gone to the bank for a walk. Don't ask me too many questions. That's what the daughter faced. That's when the family realized that it wasn't really just forgetfulness. Something deeper was going on. And while they were still laughing about the mixer grinders, the financial risks were very, very real for the family. Because here was a gentleman who refused help, who refused to accept that he had problems, but at the same time, the family was really seeing how things were going out of hand. So these are real people, real lives, real problem. What is the real solution? What is the real future for these family members? How do they deal? How do they manage the financial risks that are presented? Now, I'm going to give you some narratives of families that are navigating the dementia care cost at this time in India. I'm giving you a picture of India. So there are three cases. One is the middle class family, the other is the rural caregiver, and the other is the wealthy family. So if I start with the middle class family struggle, I have a character. This is a retired couple in Kolkata where the husband is diagnosed with dementia. Challenges: the wife has no pension and their savings are starting to decline due to caregiving costs and frequent hospital visits. What's the impact? The financial impact? They initially could afford private care, somebody coming home to take care. But as the progression kept moving forward, it was impossible for the family members to deal with the expenses. This is one narrative of, I would say, 90% of middle class families. And then you come to the rural caregiver burden. This is a family member in Orissa where the grandmother has dementia. Challenges: no specialized care facilities are nearby where they live in the rural setting. They rely on untrained relatives to take care of the person. What's the financial impact? Selling land, and that's not just for dementia. If you really stand at one of these hospitals here in Kolkata, you will hear these stories that I've sold my land, I've sold my house to pay for the medical bills. But funds are running too quickly. So what do they do? And lastly, you have the case of the wealthy family dilemma. This is an affluent businessman in Delhi whose father has dementia. Challenges: what are the challenges? The cost of premium daycare facilities is very high because a wealthy family is not going to send their father or their loved one to just any facility. The first time I remember someone from the wealthy family coming to our daycare in Kolkata and saying that you don't have AC machines, you don't have good furniture in the sense good sofa, nice looking, physical environment. Because my father is going to be spending his time here, and you have to ensure that the physical environment is up to his how he has lived his life. It's very unfortunate sometimes, but we have to really tell the family members that at some point of time, your physical environment should just ensure safety. That's what you should be really looking into. The others are not that relevant. It is the people who are caring for the family, your family member, their training, their understanding, their empathy is more important than having an AC or having lovely furnishings. So this is a problem, and they do face a lot of challenges because they're really looking for a replacement of their own private, you know, apartment building. So finding a care facility that would be premium is also sometimes costly. There are a lot coming up in India, and even though they offer a lot of good facility, they are still a huge struggle. But besides the financial difficulties, it's the emotional burden, the burnout of the family members, and planning for the long term care that is a huge issue. So, the financial impact is basically, despite the wealth, the unpredictability of dementia care affects their funds. Because today you have your father who's moving around doing things on their own. Suddenly, over a very short period of time, they need at least two caregivers day in and day out. or they need a lot of other supportive equipments to keep them going. So the cost is never ending. So if we really go into the costs of dementia, I have basically divided it into three parts. Number one is the direct cost, which everybody sees, the medical expenses, hospitalizations, doctor visits. I mean, the day that your father or your mother or your loved one, whoever is experiencing some dementia issues, you go to a doctor and your journey starts from there, right? And you are asked to come back every 3 months for a review. And you have to ensure that you go back again and again, making sure that the medications are reviewed, making sure that whatever you are doing is going the correct way. Or sometimes, if there is a decline, sudden decline, depending on the type of dementia, if that person has vascular dementia, it's a step-like decline, and therefore the person is steady for some time and then a sudden decline, and that sudden decline needs a doctor visit, needs a review of medication, needs hospitalization sometimes. So diagnostics, MRI scans, CT scans, clinical practice is so high, right? I mean, this is something, the diagnosis itself is very, very time consuming and needs a lot of clinical tests to understand what exactly is happening in the brain. And therefore, these have high costs, the scans and the reports. Medications, unfortunately, the medications globally really do not make huge difference, but medications are nonetheless given because they address the symptoms that are causing real problems for the family. So all the medications that are given in dementia are basically to manage the symptoms, not the condition, not the disease that has caused the dementia symptoms, because that medication is not yet out anywhere in the world. But medications are a part of life, and this is not just the medications for dementia, it could be also for other chronic diseases. And then, of course, hospitalization. Because anything that happens, we had this gentleman last week who fell down, and it was in the middle of the night, and the wife was alone, and she was so scared, she didn't know what to do. And so she called the emergency van and took him to the hospital. And he was hospitalized for 15 days there. Investigative tests and trying to find out why he fell down. Now these hospitalizations are sudden, right? And it means costs. Caregiving cost is a huge issue because many of you know that a person living with dementia can live on an average 8 to 12 years, depending, of course, on the type of dementia they have, any other chronic illnesses they have, also what age their dementia was diagnosed. So, depending on all these factors, the caregiving costs vary. With change in the family structure, you really don't have a lot of family members taking care of that person, taking turns to take care of that person. So you're bound to hire professional caregivers to take care, or home attendants. So for 8 to 12 years, if you are really hiring a caregiver, daytime, nighttime sometimes, imagine the cost. So this is becoming a real problem. How do we come up with a solution which will be helpful, effective for India? Because if I am talking about India, then I'm talking about 70% of the population that lives in the rural areas. We're only talking about 30% who can afford really. So any solutions that we have, any solutions that we think of should really address that 70% first and then come to that 30%. Residential homes and dementia daycare centers where available also add to the financial burden. There are a lot of these homes that are coming up and daycare centers, but these have costs. It depends on family members who really do not have immediate family to take care, and therefore they cannot really hire professionals at home and leave because they probably are living abroad. So they want to ensure that safety of their loved ones are maintained, and therefore they choose these residential homes or daycare centers where it is probably managed well. And that definitely is a huge cost. On an average, 30,000-40,000 basic in Kolkata to begin with. Forget about the other cities in India. Then comes the indirect cost. What are the indirect costs? I have met a lot of family members, sons, daughters, daughter-in-laws, who have left their jobs to start to take care of their loved ones with dementia because there was no other way. They really couldn't afford to keep working at the same time, look after their loved ones. So a lot of these caregivers, particularly women, because women constitute 70% of caregivers globally, and this is unpaid caregiving happening all around the world. And according to the World Health Organization, 70% of informal caregivers for dementia in India are women, many of whom face career interruptions. And they want to come back. I met this lady after 6 years when her husband passed away with dementia, and she came back and said, I was a banker. I want to get back because I'm physically okay and I still feel that my brain is still functioning well, and I would really want to get back to work. What are my options? So there are people who want to come back. Do we have, or do we have plans for these people who want to come back? The third is the hidden cost. Extremely important. These are not taken into account. The most important thing that is taken into account once the diagnosis is done is the direct cost. Hidden cost is the home modifications, because as caregivers, when we visit homes and we do make an assessment of the home environment, the people who live in the environment, the physicality of the environment, we are always suggesting the family members that in terms of your bedroom, you have to move your furniture, you have to remove this, you have to bring in a new furniture here to make it easier. Maybe a chair that is okay for this person. This chair is not going to work. Going to the toilet, suggesting the family members that you need to break this part, come up with a new setup which will be helpful for that person. Or maybe all these grab bars and installing the anti-slip mats that have come up, that is definitely good for safety, but this modification needs costs. And then emotional burnout also leads to productivity loss and sometimes therapy experiences. I have a lot of men as caregivers who have come to me and said, ma'am, I want to continue looking after my mother. I have left my job in Mumbai and I'm here in Kolkata because I want to be beside my mother. I'm looking for a job, but it is becoming very difficult for me to find a job here, and therefore I'm losing my mental balance and I need therapy. And that also is a cost, because therapy classes, there's a value added to that, right? So that person also has to spend on that. So on a larger scale, these are the three costs that we see if we have to understand dementia costs: the direct cost, the indirect cost, and the hidden cost. Now, here's the actual, I'm sorry, this is really light. This is the actual dementia care cost in India. This is an estimated cost. 4 lakhs, about 25% is caregiving cost, which includes salaries of the caregivers, lost income of the family member. Medical expenses come next, 18.5%, around 3 lakhs. Cost of doctor visits, medications, hospitalizations. Number 3 is the services, the daycare, the respite services, which is about 12.3%. They are the charges that are taken into account for enrolling the loved one in structured programs. And then comes the emergency fund, which is about 12.3% again. And this is a reserve that a family needs to keep for sudden hospitalization. Home modification, which is about 9.3%, 1.5 lakhs. Safety tools that are needed to reduce falls at home, disorientation. So you need a lot of signages, you need a lot of color changes in the house, you need to cover your mirrors, things that could be ongoing list. And that is sometimes needed to ensure that the person keeps going and lives a quality, enriching life. Then comes the legal and financial planning. There are a lot of family members who come to us and say, we need to really start planning, and who do we go to? And obviously, these are legal experts they have to go to, and that accounts for about 9.3%. And it costs, it covers the cost of legal guardianship or POA, power of attorney, which a family member really needs to start doing. Number 7 is well-being and enrichment, which is about 1.2 lakhs, 7.4%. These are for therapies and social engagements. Unfortunate, sometimes we feel that if number 7 was number 2, things would have been different, because especially in dementia care, where 90% of the well-being of the person depends on a caregiver. If a caregiver is well trained and if a caregiver really knows their job well, then it's much easier to manage, not control. A lot of times I keep hearing the word, how do I control this symptom? It's not about controlling, it's about managing the symptom. And you're not expected to perform, 100%. Whatever is working well is your answer. And I think if we could focus on well-being and enrichment for people living with dementia, we would definitely decrease the medical expenses, other than the usual, vital issues that they have. Unfortunately, the first line of intervention for most family members is medical. If they're hallucinating, then the first person they would go to is a doctor, right? And obviously, listening to a family member, the first approach would be to reduce that hallucination, and it's always through medications. I remember a case where the person was basically having hallucinations, more visual hallucinations than auditory. And we suggested various ways, various approaches of how to change the communication with that person while that person was hallucinating. And things took a beautiful turn, and it became basically an engagement activity. That hallucination became an engagement activity between the caregiver and the person living with dementia, because here the person was saying, I think somebody's entering the house. I can see the curtain moving a lot. Now, for the person living with dementia, it's very difficult to analyze that because of the fan, the curtains are moving. They are unable to analyze that information. And I, as a caregiver on the opposite side, I'm trying to prove and I'm trying to bring that person to reality. So I'm trying to say, no, no one is coming. You're seeing it wrong. That's just the curtains moving. There's no one coming. And the conversation starts, and you have the answer and another answer and another answer, and it goes out of hand. And the person is really angry and aggravated. And here you are standing and saying, oh, it's so difficult to take care of a person living with dementia, because you are not entering their reality. You are expecting that person to enter your reality. So I guess if we can really have, and we try a lot to really inform the medical professionals that if they could, as a first line of intervention, request the family members to try the well-being, the non-pharmacological interventions as the first line. If it does not work, we have a time limit. It does not work, we go into the medical pharmacological intervention. But all said and done, a lot of review assessment needs to be done by an expert along with the family members. We really need to understand whatever non-pharmacological advices I am suggesting for the family, if the family member is okay to practice those. If they are not in any capacity to practice those, then we cannot really suggest that. So here you saw the actual costs. This is basically a graph that the blue solid line, it represents the projected number of people living with dementia. It's going to increase, as you can see, over time. 2045 is the year that we have seen, you can see in the graph. 2045, that's the number of people living with dementia in India. And then the red line shows the estimated financial burden per family caring for a person with dementia. So you can see 2025, 2.8 lakhs, very, very average number. And then by 2045, it's going to be 10.5. So it's going to increase sharply, and this is irrespective of wherever they live. And it's going to be something that we really need to think, and how do we focus? Where do we focus? Do we focus on prevention of dementia then? Ensuring that the numbers don't increase? And that's one of the strategies that we as an organization are trying to help people understand what are the risks and what are the preventive measures that we can take so we avoid developing dementia in our lives. Because all of us sitting here, we are going to age, right? And as we age, our chances of developing dementia increases. And that's what, not something I'm saying, that's what research is saying. And aging is something that is absolutely natural. All of us are going to age. How do we avoid having dementia? That is very important for us at this point of time, because if we need to decrease the number, which is very much in the agenda, we need to take up a few steps. So the, the key takeaway from the two graphs that we have, both prevalence and care costs are projected to more than triple over 20 years. And this underscores the urgent need for preparedness. How do we prepare ourselves, not just as a society, but as individuals? Each one needs to take responsibility of their brain health. You cannot depend on other people to take care of your brain health. You yourself will have to take care of your brain health. And of course, the investments that we need to make right now. How do we prepare? How do we invest in training? One of the areas that is absolutely neglected, not just in India, most of the places in the world, training is always thought of as a one-off event. You get trained and you know everything. And that is a huge issue in dementia care, because you get trained and you think, I know it all. Here I'm standing after 30 years, and as I have a new person living with dementia enter my center, I'm relearning. Because here is a new individual entering with new life history, with everything new. And if I am trying to push all the things that I know into this person, it's probably not going to work. So I think investment in training is something that we really need to come up with as organizations. So early detection and prevention is one big step that we need to really focus on. And this is a issue globally. Caregiver support system. How do we support family members living with dementia? Forget about the paid caregivers. They can come later. How do we support the family members? Because they know the best. They understand their loved ones with dementia like no one else. I could be an expert with all my degrees in the world, but I don't know that person well, like the family member. So if we can support family members well, we will reduce a lot of the costs. Affordable dementia care services is very much the need of the hour. How do we ensure that we are able to cater to every kind of people who walks into us and says, we need help? And for that, we just need to change our mindset sometimes. Because I remember many, many years back at our daycare center, This young boy comes and says, my mother has dementia and I am not able to take care of her because I have a shop, পানের দোকান আমার আছে, সেই পানের দোকানে আমাকে সারাদিন বসতে হয়, I have to sit in that পানের দোকান all day. I can't be looking after my mother. Can you really take care of her? And I said, yes, why not? And she started to come the next day. And he was a lady from the rural background, so she was doing things that a lot of the urban people, even though they know the rituals and mannerisms, they're not used to it. And unfortunate but surprising that the people living with dementia in the daycare center had no problem with her. Absolutely no problem with her. In fact, really becoming very curious and trying to help her out. You know, people telling her, because she was sitting down to eat her lunch and they were inviting her to sit up with them in the table and sit and have lunch. But it was the family members who came in the evening and said, why is she here? Why would she be here along with my husband? Because he comes from a certain status. And I do not want him to be with any such people. So this is something that we faced. You may have a different experience, but we have faced this several times. And therefore in India, you have so-called places where it's for free, and those are for people who are absolutely under poverty level, and then you have people who can afford. And I'm segregating these two. That's a huge problem. Public health awareness, and I think this is where the government and the society needs to come and focus on how we as a society, as a community, as a body, help build health awareness. Most of the issues that we face in life are because we are not aware, we are not educated, we don't have the knowledge, or we really don't want to be sometimes understand. You know, in terms of being diabetic, I know what diabetic is, but I'm relying 100% on medication to cure it. I'm not really focusing on all the other issues that I could really take up. And that's where I think the education really needs to happen as to what somebody could do right from their childhood, younger days, to ensure that they are not diabetic, they're not hypertensive, or they can really manage it well. Now comes the step-by-step financial planning process in dementia care. This is very important. And this, believe me, there are 6 steps, but it will vary depending on each family background. But the overall idea is going to be applicable to any kind of family setting. Number 1 is helping the family assess their current financial status. Right now, what is their status? So they will give you all the information. They really need to sit down as a family and put all the information in paper, not, you know, just verbally discussing, but putting into paper and seeing what is their current financial status. Who are going to be involved in ensuring that the financial status that we have right now will keep looking the same. So it could involve the children, it could involve other relatives, it could involve any other people who are involved. The number 2 step is creating a monthly budget. And I think I have no experience in your kind of setting, but in our setting, that's one of the things that we tell as soon as the diagnosis is done and the doctor refers us to, you know, the family is referred to us. And the first thing we tell them is create a monthly budget. What are the expenses, you know, that you would have as a family? Because if you write it down and you tick it and you say, yes, these are my priorities, I cannot avoid it, and then there are some things in my budget that I could avoid this month. So a monthly budget every month is needed. Number 3 is evaluating my insurance coverage. What insurance do I have? What is it going to cover? Because dementia care hardly covers. So we will have to find out what are the insurance coverage. What is my insurance going to cover? Number 4 is setting up emergency funds. like I was saying, that it is very important. It could be hospitalization, it could be buying something that you did not have planned to. So setting up emergency funds. Number 5 is exploring additional income sometimes. So you have family members. We do actually have few family members who are taking care of their loved ones with dementia. Now, while their loved ones with dementia are with us at the daycare center, we explore, we in fact motivate them to take up something for a few hours, at least 6 hours. That's the time that they are with us, and try and see if they could, have some income. And that's not just financial benefit, but also emotional and mental benefit that they would have going out and talking to people. And last one is, of course, community support and government benefits. Exploring what are the government benefits that I could really explore in planning process while I'm planning this. So in terms of family, this is the call to action. Number 1, most of the family members hate to involve other family members in this financial struggle. They always feel that I don't want any other family members to know how I'm struggling. And I've seen parents refusing to take help from their children, saying that, my husband has never taken any help ever, and I really don't want to take help even now. And later, the children have really regretted not being there when they really needed that financial help. So, sharing caregiving responsibilities and financial burden is a part of being a family, and a family member really needs to understand that. We also help sometimes family, once they have done the budget, help them cut costs without sacrificing the quality of care. And how do we come up with that? Use government hospitals for diagnostics and checkups. And they are equally good, believe me. The doctors there at the government hospitals and the checkups that are done, they're not so poor as we think. It's just that we don't want to. It's just the sheer number of people there that keeps us away from that place. But if I have a financial burden, then I can really think of government hospitals for diagnostics and checkups as an option. Telemedication consultation is coming up as a technology that is really helping people. If you sit at home and through telemedication consultation online, you can save on travel. People traveling all the way to south for their diagnosis and all, we could really cut those costs. Explore local community services offering subsidized care. This is very important. There are a lot of care happening that are absolutely low cost, and we really need to find out what are the local community services that are offered within my setting. Utilize free resources. We are always ashamed to use free resources, and especially certain section of our community do not want to use free resources. They feel that is against their financial background. But utilizing free resources is given with a purpose. It is given for you to be educated, to be empowered, and therefore it is important that you utilize these resources. And lastly, explore financial counseling services if facing overwhelming debt or financial strain. So we also need to go out and see there are a lot of people really offering free financial services also. There are a lot of good people, good souls out there. And I think as family members and as professionals or as organizations, we really need to explore, have a directory of all these services that can help family members. If I have to ask the government or the society to act on this issue, then the first thing that I feel we need to do is really ask the government and the society as a whole to help us build a dementia-friendly community. People should be really accepting of a person living with dementia. And I really don't have to spell this out for you. You know the best how much struggle that people with any kind of mental health issues face out in the community. And I feel that half the job is done if we can really build a friendly community where the community is accepting of the other person's difficulties and challenges. Being sensitive is all we need to do, and it really cannot happen when I am 40 or 50. That practice really needs to happen when a child is going to a school, and you cannot have a mother pulling that child while the child is offering help. The mother, I hear a lot of mothers say, সময় নষ্ট করিস না, চল তোর পরীক্ষা আছে, you have to get full marks here, don't focus on somebody who is trying to cross the road and needs help, don't help, you have to be on time for the exam. So if I am really focused on and prioritizing what is important in life, then I would have a child growing up being not that sensitive to somebody else. So I think the focus has to be very much from childhood, being sensitive. Establishment of community-based care homes and subsidized caregiving services. This is a concept that is really coming up. And you will also see developing cooperative caregiving models. These are the two things that are really coming up, where a community really builds this support system. Caregivers are trained and they are looking for their community members. So the community members really don't have to leave their homes. It's within their community. So we really have to look at these things and ensure that there are a lot more. I mean, if I really look at South Kolkata, we have, as far as I'm aware, there are only 2 daycare centers in southern part of Kolkata. 2 dementia specialized daycare center. Imagine the area that is covered for South Calcutta, and only 2 daycare centers. I think establishment of more and more community centers is needed. Provide free caregiver training for family members, which we as an organization do. Our family members are trained, are given, provided with training, counseling, and not just once, over and over again, first initially physically and then over the phone. Because the dementia phase changes. So early stage, there are certain issues, and then the mid stage and the late stage. So one training doesn't help. So you have to continuously keep training the family members. Build more affordable dementia daycare and residential care in rural areas. As an organization, we have been visiting the rural areas as part of an initiative that we started, educating the rural women and girls in dementia care. And we found that they were really interested to start such centers in their community. And something like that would really benefit. NGOs should set up community daycare funds for low-income families. And as an organization, that is something we do. So whatever the fees or the funds that we receive, one corpus is set aside for people who really cannot afford to pay for the home visit or pay for the dementia daycare center. That money is used for them. We also have to explore and see if the government can help us in mandatory insurance coverage for neurodegenerative diseases. Tax deduction for caregiving expenses. If a family member is leaving their job and going into unpaid full-time caregiving, is there any kind of tax deduction for this? Or if a family member is working and earning at the same time, can we really look for any tax deduction? And of course, more inclusive health insurance coverage for dementia care. So these are some of the call for action. Now, in terms of my theoretical presentation, I'm done with it. This is, I don't know how much time I have, but I was thinking that this is a real world budgeting exercise. We really don't need to do this today. I will leave my presentation with you. But in your class, if you could explore this exercise, where basically imagine that you have a parent who is diagnosed with dementia and you have 10 lakhs to manage their care over a long period of time. How will you allocate your funds? And here what I've done is I've shared the expense categories: medical expense, caregiving costs, home modifications, all that we discussed. Now we will make groups and each group, probably 2 or 3 people, sit and discuss how are we going to make a budget for a family member who has dementia and I have just 10 lakhs. And once you're done with this 10 lakhs, maybe you could also explore with less amount, 5 lakhs maybe, and see whether that is possible. And then probably each group will present their budget choices, and also they could give their explanation as to why they have prioritized certain expenses over others. Because it is very important, and any group discussion will come up with a lot of ideas, a lot of brainstorming will help you explore innovative solutions for a lot of your family members who are dealing with financial aspects. Forget dementia care, just general financial expense with any kind of person who is going through long-term care. So that was all I had. This is a documentary that we came up with in 2023. And this documentary was selected by the Kolkata Film Festival, and it was shown there. You could take a picture on your phone, and this is available on YouTube. The documentary is named Muhurto, which is moment. And this documentary is about how a family member takes care of a person living with dementia, and what are the stages that the person living with dementia goes through, and also the family member, and what is the reality of taking care of a person living with dementia. Because at one stage you feel that probably the person is remembering things back or able to do things, and you are very positive and you feel that the medications are working, and probably all the damages that have happened to the brain are reversing. But then again, the next moment, the person living with dementia will do something that will crash your dreams. So that documentary is all about that. That was all from me. I hope it was helpful. And if you have any questions, please. Thank you.
Questions? কোনো প্রশ্ন আছে? বাংলায় বলা যাবে, কোনো সমস্যা নেই। আর কোনো প্রশ্ন আছে কি?
Having no questions is a huge issue for me. Sorry, Kalyan is there. Because if we don't have questions, we will not be able to solve problems. That's what I feel. But many of us feel that, am I asking the right question? There's no right question in dementia care, at least. Whatever you ask is the right question.
Madam, এখন কি existing কোনো insurance রয়েছে যেটা dementia care কে support করছে?
No, not that I'm aware of. মেডিকেল ইন্স্যুরেন্স যেগুলো আছে সেগুলো বেশিরভাগই অন্য মেন্টাল হেলথ ইস্যুজে কিছু কিছু জিনিসে কভার করে, যদিও ডিমেনশিয়া ইজ স্টেজ disability wise it's stage 4-5, but it's still not included in any it's not just in India, even abroad insurance don't coverage the care benefits or the caregiving aspect is not covered at all. If I go for diagnosis medications, I'm not sure if that is not in India.
The caregiverরা যদি বিল দেয় তাহলে তাদের একটা রেজিস্ট্রেশন নাম্বার দরকার, যেটা রেসপেক্টে তারা বিলটা দিতে পারে। এরকম কি কোনো আইন রয়েছে?
You mean the caregiver যারা আছেন ফ্যামিলি caregiver তারা একটা বিল
প্রফেশনাল কেয়ারগিভার
professional caregiver যদি একটা বিল দেয় and then
তার জন্য একটা রেজিস্ট্রেশন নাম্বার লাগে যার এগেইনস্টে বিলটা ইস্যু হবে।
Now if I ask you who are the caregivers, এই caregivers রা কারা আমাদের দেশে? এই caregivers এমনই বেশিরভাগ যারা যারা তাদের তো এই রেজিস্ট্রেশন নাম্বার নেই, তাই না? এবার যদি তারা কোনো সংস্থার হয়ে কাজ করে তাহলে তো রেজিস্ট্রেশন নাম্বার আছে। হ্যাঁ, 100 বার দিতে পারবে, সংস্থা হলে 100 বার দিতে পারবে। কিন্তু আমি জানি না যে বেশি যারা হোম অ্যাটেন্ডেন্স আসছে তারা যাদের হয়ে কাজ করছে তারা কোনো রেজিস্ট্রেশন নাম্বার দিতে পারবে কিনা। যদি তারা দিতে পারতো তাহলে কিন্তু ওটা হেল্পফুল হতো।
আর হ্যাঁ কি ইন্স্যুরেন্সটা করা যাবে যদি আমি ডিমেনশিয়া আক্রান্ত হয়ে থাকে যদি ডিমেনশিয়ার প্রবলেম থাকে তাহলে কি আমার ইন্স্যুরেন্স হবে না সেটা হবে না
তোমার যদি ডিমেনশিয়া হয় তাহলে তোমার ইন্স্যুরেন্স হবে কিনা, মেবি তোমার যতদিনে ডিমেনশিয়া হবে ততদিনে হয়তো ইন্স্যুরেন্স কভার হয়ে যাবে। এখন এই মুহূর্তে কোনো ইন্স্যুরেন্স কভার করে না। ভেরি ফিউ টেস্ট দ্যাট আর, মানে ভেরি ফিউ, মানে আজকে একজন ডিমেনশিয়া মানুষ অসুস্থ হয়ে যদি হাসপাতালে ভর্তি হয় তাহলে ডিমেনশিয়ার জন্য নট নেসেসারি ভর্তি হচ্ছে, ফর আদার ইস্যুস ভর্তি হচ্ছে, সেটা হয়তো ইন্স্যুরেন্স কভার করছে। কিন্তু আমি যদি স্পেসিফিক্যালি ডিমেনশিয়া ধরি তাহলে সেটা এই মুহূর্তে হচ্ছে না। না, হ্যাঁ একদমই। সেই জন্য বেশিরভাগই আমরা বাড়ির লোকে সেটাও বলি যে ইয়েস ডিমেনশিয়া ইস্যুস হচ্ছে, কিন্তু যখন যাচ্ছে হাসপাতালে তখন তো আদার ইস্যুস কভার হচ্ছে, ক্রনিক ইস্যুস গুলো হচ্ছে, সেটার উপরে ফোকাস করবেন, কখনোই বলবেন না ডিমেনশিয়া ইস্যুস হয়ে এসছে, আদারওয়াইজ আপনার মুশকিল হবে কভার করতে।
আমার দুটো কোয়েশ্চেন আছে। একটা হচ্ছে সাদার্ন পার্ট অফ কলকাতায় যে দুটো অর্গানাইজেশন করে, একটা ARDSI একটা ডিগ্রি ফাউন্ডেশন, আর কি কিছু আছে?
আমার মানে একটা ফেসিলিটি যেখানে ডিমেনশিয়া মানুষরা এসে সারাদিন কাটান সেরকম আমার খুব একটা জানা নেই। আই মে বি রং, বাট আই এম নট অ্যাওয়্যার। ইউজুয়ালি কিছু হলে আমি খবর পাই, কিন্তু আমি কিছু সেরকম খবর পাইনি। মানে বেশিরভাগ যার সংস্থা যারা হয়েছে তারা বাড়িতে গিয়ে কেয়ার দিচ্ছে, সো দে আর গোয়িং হোম অ্যান্ড প্রোভাইডিং দ্য কেয়ার, ওরকম সংস্থা অনেক হয়েছে। কিন্তু কোনো একটা ফেসিলিটি আছে যেখানে আসছেন ডিমেনশিয়া মানুষেরা, তাদের একটা সারাদিনের জন্য কেয়ার নেওয়া হচ্ছে, নট জাস্ট দি ফিজিক্যাল কেয়ার বাট অলসো দি কগনিটিভ, ইমোশনাল, সোশ্যাল সব অ্যাসপেক্ট গুলো, সেরকম আমার মনে হয় আমার জানা দুটোই আছে।
এছাড়া আর কারো কোনো তথ্য আছে?
ফ্রি কেয়ার ফর ডিমেনশিয়া পেশেন্ট ইন ইন্ডিয়া, ফ্রি কেয়ার।
ফ্রি কেয়ার, এবার কেয়ারটা মানে আপনি যদি একটু ডিফাইন করেন কেয়ারটা বলতে কি?
জাস্ট লাইক যে কেয়ার আপনি যেমন বলছেন
হুম
টাকার বিনিময়ে যাকে রাখা হয়,
হুম।
জাস্ট লাইক ফ্রি কেয়ার, যে টাকা নেই সে কি পাবে?
ইন্ডিয়া যদি বলেন তাহলে আছে, হ্যাঁ ইন্ডিয়া যদি বলেন তাহলে আছে। আমি আপনি যদি ওয়েস্ট বেঙ্গল বলেন নেই, ইন্ডিয়া যদি বলেন আছে, ব্যাঙ্গালোরে আছে, সাউথে আছে, কেরালাতে আছে, এবং সেইখানে কিন্তু ফ্রি ডে কেয়ার সেন্টার আছে। গভর্নমেন্ট ইনভলভ, এডেড কিনা জানি না, কিন্তু ইনভলভ আছে, কোনোভাবে গভর্নমেন্ট সাপোর্ট করছে কোনো একটা ইনিশিয়েটিভ, কিন্তু পয়সা দিচ্ছে কিনা জানি না, কিন্তু সেখানে গভর্নমেন্ট ইনভলভ আছে। কেরালা আছে, ব্যাঙ্গালোরে আছে, and those are supported, মানে Bangalore is supported by uh, private foundations like Azim Premji Foundation. They support a lot of these free centers. একজন ডিমেনশিয়া মানুষের ইফ ইউ আর, আপনি যদি রেফার করছেন, আমি এখানে যেটা মেনশন করেছি আদার সোর্স অফ ইনকাম, সেটা আমি ফ্যামিলি কেয়ার গিভারদের জন্য করেছি। ডিমেনশিয়া মানুষের এরকম অনেক হয়েছে, ইউজুয়ালি আর্লি স্টেজে তো ডায়াগনোসিস হয় না, মিড স্টেজে গিয়ে ডায়াগনোসিস হয়। এরকম অনেকের হয়েছে যাদের আর্লি স্টেজে ডায়াগনোসিস হয়েছে। একজন ট্রাফিক পুলিশ যার ডায়াগনোসিস হয়েছিল আর্লি স্টেজে, এবং তিনি তখনও লালবাজারে কাজ করছে, মানে লালবাজারে রিপোর্ট করতে হয় ওনাকে। এবার ওনাকে, ওনার তখনও 3 বছর বাকি ছিল কাজের, তো আমরা তখন গিয়ে লালবাজারে কথা বলে যে এনাকে এমন কিছু কাজ দেওয়া যায় যেখানে ওনার সেফটিটা হ্যাম্পার হবে না, কারণ উনি তখন রাস্তায় দাঁড়াচ্ছিলেন। সেখানে ওনাকে ডেস্ক জব দেওয়া হলো, and for 3 years his wife would come and sit with him, and ওইটা উনি করতে পেরেছিলেন। সেটা বেশিরভাগ ক্ষেত্রেই হয় না, কারণ ডিমেনশিয়া মানুষ বেশিরভাগ ক্ষেত্রেই মিড স্টেজে ধরা পড়ে, এবং তখন তাদের কাজ করার ক্ষমতা, মানে একটা জায়গায় গিয়ে কাজ করবেন, অ্যাকাউন্টেবল থাকবেন, সেইটা সম্ভব হয় না। কিন্তু ফ্যামিলি মেম্বারসদের ক্ষেত্রে সেই অপশনাল ইনকামটা আমরা এক্সপ্লোর করতে বলি। আচ্ছা, আমি যা বলেছি সেটা মানে বোঝা গেছে তো? মানে আমি ভাবলাম আমি তো ইংরেজিতে বলে গেলাম, কিন্তু আমার কি ভাষাটা ইংরেজিতে পুরোটা বলা উচিত হলো? সো হ্যাঁ, মানে কোনো রকম যদি কিছু প্রশ্ন থাকে প্লিজ ফিল ফ্রি টু কোয়েশ্চেন।
আমার দিদার বয়স এখন 70 আপ হবে। তো আমি এখন একটু লক্ষ্য করছি যে মাঝে মাঝে কোথায় জিনিস কাটছে বা সারাদিনের যে শিডিউলটা আমরা বানিয়ে রাখি যে এটা করে এটা করবো, এগুলো হালকা হালকা করে ভুলে যাচ্ছি। তো এরকম কি কোনো ব্যাপার আছে যে ডিমেনশিয়া না হওয়ার জন্য আমরা এখন যদি কিছু এক্সারসাইজ বা কিছু করতে লাগে?
মানে তুমি কি করবে এখন থেকে, তাই তো? তাহলে মা, তোমাকে করতে হবে না, তোমাকেও করতে হবে কিন্তু। হ্যাঁ, ডেফিনেটলি, রাইট রাইট। সো গোয়িং ব্যাক টু ইউর গ্র্যান্ডমাদার, তোমার দিদার ক্ষেত্রে যদি আমি বলি, তাহলে একটা বয়সের সাথে সাথে আমাদের যেমন চুল সাদা হতে থাকে, কানে কম শুনি, আমি যেমন চোখে তোমাকে আবছা দেখছি, তেমনি বয়সের সাথে সাথে আমাদের ভুলভ্রান্তি তো স্বাভাবিক, তাই তো? এবার আমাকে দেখতে হবে সেই ভুলভ্রান্তিটা কতখানি স্বাভাবিকের থেকে আলাদা দিদার হয়েছে। ওকে, এবার তাহলে যদি ডায়াগনোসিস হয়ে যায় তাহলে নিশ্চয়ই চিন্তা করতে হবে মায়ের ক্ষেত্রে এবং আমার ক্ষেত্রে, মানে তোমার ক্ষেত্রে, রাইট? তাহলে যদি আমি প্রিভেনশনের দিকে যাই, তাহলে দে আর অ্যাজ সিম্পল অ্যাজ হোয়াট এভার ইউ ডু টু কিপ ইউর হার্ট ওয়েল। হার্টকে ভালো রাখার জন্য আমাদের কি কি করতে বলা হয়? খেতে ঠিক করে বলা হয়, এক্সারসাইজ করতে বলা হয়, রাইট? দিজ আর দ্য টু থিংস দ্যাট আর অলসো অ্যাপ্লিকেবল ফর a good brain. আমাকে এক্সারসাইজ, মানে রিসার্চ হ্যাজ এগেইন এন্ড এগেইন প্রুভ দ্যাট ফিজিক্যাল এক্সারসাইজ ডিরেক্টলি ইম্প্যাক্টস ব্রেন হেলথ। আমি যদি এক্সারসাইজ করতে পারি, এবং আমি এখন মনে করছি তোমার বয়সে গিয়ে যে আমার তো বয়স পড়ে আছে, আমি এখন কেন এক্সারসাইজ করব, কিন্তু এখন থেকে এক্সারসাইজ যদি আমি শুরু করি তাহলে আমি ওইটা রুটিনের মধ্যে যেতে পারবো, রাইট? তাহলে এক্সারসাইজ অ্যাটলিস্ট 20 minutes a day is recommended by World Health Organization for everyone irrespective of their age. দ্বিতীয় হচ্ছে খাওয়া দাওয়া। খাওয়া দাওয়া বলতে সঠিক খাওয়া, মানে তোমার দিদা যেটা খেত সেই খাওয়াটাই যদি আমরাও মেনটেন করতে পারি, আমাদের ঠাকুমা যা খেয়ে এসছেন সেটা যদি আমরা মেনটেন করতে পারি, যেটা আমরা করি না, most of us really don't follow that regime. Lot of options now, আমাদের কাছে অনেক অপশনস খাওয়ার এখন, যদিও সেটা একেবারেই ভালো না, কিন্তু আমরা ওই অপশনস গুলোকে খুব সহজে নিই। আর দুটো জিনিস, যেটা একটা হচ্ছে মেন্টাল স্টিমুলেশন। কাজে আমি যদি এমন কাজ করি দৈনন্দিন যার কোনো ভ্যারিয়েশন নেই, যার কোনো ভ্যারাইটি নেই, প্রতিদিনই রান্না করি, প্রতিদিনই ঘর পরিষ্কার করি, প্রতিদিন যারা হোম মেকার্স যারা বলছি আমি, তাদের ওই কাজের মধ্যে কোথাও ভ্যারাইটি আনতে হবে, কোথাও মেন্টালি নিজেকে স্টিমুলেটেড রাখতে হবে ওই কাজের মধ্যে, ইউজুয়াল কাজের মধ্যে। সো ভ্যারাইটি ইজ দ্য কি। আই হ্যাভ টু রিয়েলি স্টিমুলেট অ্যান্ড আই হ্যাভ টু ট্রাই আউট ডিফারেন্ট থিংস। আমি রান্না করছি ডান হাত দিয়ে, কড়াই খুন্তি নাড়ি, আমাকে বাঁ হাত দিয়ে মাঝে মধ্যে নাড়তে হবে। So the moment I am using my non-dominant hand, my brain is starting to work, right? তো এরকম ছোট ছোট জিনিস আমাকে I have to really start to incorporate in my daily lives. আমি যখন বাড়ির থেকে এখানে আসছি, ইউজুয়ালি আমরা নিচু করে ফোনটা দেখি, তাই তো? The moment I stop my phone and I look outside at the world outside, my eyes and my brain are really trying to find what is new. আমার পায়ে নতুন দোকান কি এলো, right? And those simple activities actually stimulated your brain like nothing else. And the last one is social engagement, যেটা আমাদের ভীষণভাবে কমে আসছে, right? We love to spend time with ourselves, with our phone, not just ourselves হলে তো ভালো হতো, with our phone in hand. Well, I understand that phone is the biggest discovery, মানে it has opened the world to us, but যেমন অন্য কিছুর জন্য আমার সময় বাঁধা আছে, তেমনি আমাকে ফোনের জন্য সময় বাঁধতে হবে। প্রতি মুহূর্তেই আমার ফোনের দিকে তাকানো দরকার নেই, বাট আমাদের ওটা হ্যাবিট হয়ে গেছে যে আমরা, বিকজ উই আর ভেরি আনকমফোর্টেবল উইথ সাইলেন্স, আমি যদি কোথাও ধরো বাসের জন্য অপেক্ষা করছি, আমি দাঁড়িয়ে আছি, বেশিরভাগ দেখবে ফোন দেখছে, কারণ আই এম নট ইউজ টু রিয়েলি স্ট্যান্ডিং উইথ আদার আননোন পিপল অ্যান্ড এনজয়িং দ্যাট মোমেন্ট। সো আই ওয়ান্ট টু মেক আদার্স ফিল যে আমি তো এনগেজ আছি, আমি তো ফোন দেখছি, রাইট? সো এই হ্যাবিটগুলো যদি আমরা চেঞ্জ করতে পারি, দ্য মোর ইউ কিপ ইউর কিউরিওসিটি ওপেন লাইক এ ডিটেকটিভ, দ্য মোর ইউ আর অ্যাকচুয়ালি এনগেজিং। কত কথা হবে, মানে এখন এই যে আমার একটা জিনিস খুব খারাপ লাগে, সেটা হচ্ছে বাজারটা আমরা অনলাইনে কিনি। এই যে বাজার গিয়ে সবজির দোকানে মানুষের সাথে কথা বলা, মাছের বাজারে গিয়ে কেন বেশি দাম নিচ্ছ, দিস সিম্পল সোশ্যাল ইন্টারাকশন ইজ এ হিউজ বেনিফিট ফর ইউর ব্রেন। সেটাই তো আমার হচ্ছে না, রাইট? সো গুড ফুড মানে হচ্ছে গুড ফুড, মানে থিংস দ্যাট আর রিয়েলি গুড ফর ইউর বডি, আর এক্সারসাইজ, সোশ্যাল এনগেজমেন্ট অ্যান্ড মেন্টাল স্টিমুলেশন। এছাড়া আমি যেটা নিজে বিশ্বাস করি এবং প্র্যাকটিস করি, সেটা হচ্ছে টু মেক আ গ্র্যাটিটিউড লিস্ট অ্যাটলিস্ট ওয়ান্স আ মান্থ, because we are so much engaged with, you know, proving to the world that we are failing, আমার কিচ্ছু হচ্ছে না, and I'm not getting what I want in life. But if you really start to make a gratitude list end of the month, আপনারা দেখবেন যে আপনারা যে জন্য ধন্য জন্মাবার জন্য, এই ধন্যের লিস্টটা অনেক বেশি না পাওয়ার থেকে। And I think that really motivates you positively. So when I start a new month, I look at my gratitude list and I say, okay, I'm going to increase that gratitude list. So what else can I do, right? And the other thing that I practice, which সবাই জানি আমরা 8 গ্লাস জল খেতে বলা হয়, এটা একদম রিলিজিয়াসলি 8 গ্লাস জল খাওয়াটা খুব প্রয়োজন, ফ্লাশ করে আমার সিস্টেমকে, আমার অনেক কামনেস আনে। আমরা জলটাকে খুব একটা ইম্পর্টেন্স দিই না, কিন্তু 8 glasses of water if you can ensure throughout the day. And the other thing is, which I add to my everyday regime, is 8 hugs a day. So you choose anyone that you want to hug. 8 hugs a day before you go to bed. Because what it does is basically এই যে হাগ, এবং হাগটা কিন্তু একটু হালকা করে একটু ছুঁয়ে দিলে হবে না, it has to be really tight. হ্যাঁ, একটু সময় দিতে হবে, অন্তত 60 সেকেন্ড ধরে আমি যদি হাগ করি কাউকে, তাহলেই আমার শরীরের মধ্যে যে কেমিক্যালসটা ঘোরাফেরা করছে, কি ঘোরাচ্ছে, কোন কেমিক্যালস? ইয়েস। তো এই যে কেমিক্যালটা, এটা আমাকে ভীষণ ভালো রাখছে। সো ইফ ইউ ক্যান প্র্যাকটিস দ্যাট। এবং অনেকেই আমাকে জিজ্ঞেস করছে, ম্যাম আপনি তো এটা বলে দিলেন, কিন্তু ধরুন আমার 7টা হলো ঘুমাতে যাওয়ার আগে, তাহলে আমি 8টা কাকে দেবো? তখন অনেকে বলে যে হাজবেন্ড সামনে আছে কিন্তু ওকে দিতে ইচ্ছে করছে না, তাহলে কাকে দেবো? তখন আমি অনেক সময় বলি যে বাড়িতে যদি কারোর ছবি থাকে,